Hello, my name is Dr. Hillel Mazansky and I specialize in medical hypnosis, guided imagery, nutrition and exercise, my website being drdoctormedicalhypnosis.com. Today I'm going to discuss vitamin D. What does it do? Recent studies have shown that vitamin D has become one of the most important vitamins among all. Vitamin D is associated with many diseases, and we'll discuss that in a moment. Vitamin D, or the sunshine vitamin, is known to be absorbed through the skin, and sunshine assists in that absorption. But it is only amongst younger people and the younger skin where the vitamin D can be absorbed through the skin. People over the age of 45 to 50 and above, due to their age and their skin texture, have difficulty in absorbing vitamin D. Vitamin D comes in fortified orange juice, cereals, bread, etc. The importance of vitamin D is mainly in the lack thereof and what it does and what it can cause. Many studies have now proved that there is a strong association between cancer, especially of the breast, prostate, lung, and colon. Heart disease can be caused by a low vitamin D level. Stroke, dementia, are all associated with low vitamin D, as is most cancers other than we noted. Multiple sclerosis has now been found to be associated with low vitamin D, as is depression. Month after month, there are credible medical evidence that proves that vitamin D is associated with and sometimes causes the disease. Children usually get sufficient vitamin D in drinking fortified milk, fortified orange juice, and their cereals, and because they play outside. However, children with obesity tend to have low vitamin D levels because they are ostracized by their peers and they do not play outside, and the food that they eat is not extremely wholesome. Vitamin D is important for bone health and bone strength because it assists in the absorption of calcium. So a lack of vitamin D and a lack of calcium in older people can lead to a condition called osteoporosis. Scientists are still not exactly in accord with what the dosage should be. The normal value for vitamin D is 20 to 90 international units. However, researchers out of UCSD have stated that if a patient has cancer, they should have 5,000 units of vitamin D3 as a preventative. If the cancer is present, they should have as much as 10,000 units of vitamin D3. Two studies showed that in patients with multiple sclerosis, if they took 100,000 units of vitamin D3, it improved their relapsing rate and they didn't have so many relapses. Vitamin D in those high dosages can be toxic, but in all my years of practice, I've never seen a toxic dose. If you wish to prevent cancer using vitamin D, the level we suggest is 45. However, it's best to get a blood level taken in the beginning and then work yourself up until 45, and after that get a test once every 3 months to make sure you're not going higher. But as I said, we've never seen a toxic level. There's some evidence now that higher vitamin D levels lead to lesser incidence of dementia. Type 2 diabetes, heart attack, heart disease, stroke, cancer, osteoporosis, and more are all linked to a low vitamin D level. We suggest that if you take vitamin D, you take it once a day as vitamin D3, which is the active form. Take it once a day after food, as it needs fat to absorb the vitamin D. Children with obesity are now found to have extremely low vitamin D levels because they don't play outside, ostracized by their peers, and they eat the garbage foods and so have low vitamin D. Result, they have a higher incidence of type 2 diabetes, heart disease, and even stroke. Friends, this is a most important vitamin. If you don't take any other vitamins, take vitamin D3. Even for the older person or even the younger person who works indoors, even in a sunny climate, you don't have much sunlight. So it behooves you to take at least 2,000 to 3,000 units of vitamin D3. At those levels, it's non-toxic, but you can prevent many diseases and illnesses by taking vitamin D3. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.